Hello, I'm going to give you a brief overview of some jobs in public health and really kind of give you an idea of the different sectors that are under the big overarching umbrella of public health. Know that this is definitely a career where you can make a difference in your community. So let's begin. There are over 250,000 jobs in 2020 alone, and it continues to be projected further. Healthy People 2020 has an objective to really build the infrastructure of public health in the United States. There are over 7,500 different titles across many different sectors, but this gives you an overview of the sectors within public health. I like how it divides it up into four big overarching areas. Environmental health really focuses in on air quality, water. Health administration really focuses on the business aspect, the delivery, the operation aspect, making sure there's quality healthcare being delivered at a hospital to a clinic setting. Public health informatics looks at the study and the disease trends and looking at data to drive decision making, graphic design, GIS mapping. And the health educator really focuses in on outreach, programs, evaluation in a sense of looking at program design and community development. Each of these have many different titles that you'll see, and there's not one title that fits in one area. You'll see program specialist, you'll see graphic designer, or informatics or epidemiologist, to CEO and for the health administrator, to environmental health outreach worker or environmental health specialist. So when we look at this, one of the first things I'm going to drill down on is an epidemiologist. An epidemiologist really falls into that informatics area where they're really studying trends and mathematical data, and they're taking statistics and they're analyzing it, and they're using that data to help design and also investigate issues. So investigate diseases, but also design programs to do interventions to stop a disease. They have a working environment, usually in an office or lab. You'll see them at health departments and state and local governments, and hospitals, colleges, universities. Their job entry level is higher than what you see here in 2015. If you drill out to the Occupational Outlook Handbook, you can put in job title here, and it will pull up data for the median pay for whatever year it is, 2020, and you'll see that the pay level, and then you could drill down and you could see what they do to work environment, how to become one, job outlook, all this great information here. So one of the things you need to know is that they collect data on populations. They use this number to have diagnostic tools for the health of the community. They're the science of stats. They use these numbers to calculate risk and benefits. They're an integral part of studies to seek the cause of a disease or relationships, and they're really play an integral part of any clinical study testing the effectiveness of a new drug. Similarly, I put statisticians in there. They work alongside and do very similar jobs where they're looking at applied math to really look at solutions for issues. Again, entry levels around master's degree, and you can look up the different job opportunities in that Occupational Outlook Handbook. The next one is environmental science, and this is just one job title. Know that there are a lot of other similar occupations that you can look up in the Environmental Outlook Handbook. This is a screenshot from 2012. Know that you could go out to 2020 now and drill out into this handbook. And what they're seeing here is you're seeing an associate's degree, which is 2 years of community college. But know that this really goes up as the degree goes up, in a sense of a 4-year degree to a master's degree. And also there's a lot of licensing that is involved too. So as a person gets trained, they get more opportunities, but also their pay increases. They do everything that falls under environmental health, but they're also very much a classic component of public health. You'll see it in health departments. The environmental health department has its own area. They're looking at environmental exposures, air quality, water quality, solid and hazardous waste, to restaurant inspections, and also monitoring and seeing how new chemicals enter the environment every year. This is a certification I mentioned earlier. This is a screenshot from Oregon of their Environmental Health Registration Board. Know that you really need to look into whatever pathway you look into. You need to look into the certification that's involved in it. And then it goes over the background that you need to have, what degree that you need to have. Either a bachelor's degree from a university or college with at least 45 quarter hours of science background in environmental sanitation, or 2 years of experience in environmental health working under the supervision of an environmental health specialist. This is where that entry level comes in. So that's something to explore. In California, they have a registered environmental health specialist program that you can look into. And note that, again, very similarly to Oregon, you have to do a public health biology. You need to take some very specific coursework, and then you would need to take the test, or you could look into an entry-level position with the health department and continue to move forward. The next one is Biomedical Sciences. This is really falling into the infectious disease area and looking at pathogens and the control of infectious disease. I took a screenshot of a contact tracer during the COVID-19. They're used to do medical investigations. You'll see them at health departments under the title Medical Investigation, Contact Tracer. They work alongside with public health nurses. Also, you'll see in health departments in the lab, there will be a biochemist or lab technicians that are doing analysis, and they also work in this field. And then also we have an area of chronic disease and genetics that also falls under public health. And we're really looking at screenings and really tracking chronic diseases to really see what risk factors there are involved. And this really falls into that biology, really strong biology background. Next is a health educator. And a health educator works across many different areas. They could be community health workers. They could work in schools. They could work with law enforcement to do outreach programs. They could work in nonprofits. And so there are a lot of different roles. They could be a car seat specialist where they're helping someone install their car seat safely, or training people on how to install a car seat. Health educators and community health workers are different in that community health workers do have certifications in some states. In Oregon, they have a certification for community health worker. In some states, they do not. Health educators can vary based on if they have a master's level, and it really can depend on where you're at and what education is needed. One of these things is you could look into it where you're at. Again, looking at the work environment and definitely drilling down to your health department and looking at the different career opportunities, nonprofits. Again, this one goes across many different areas. The last one I was going to go over is the health care administrators. And this is really looking at the chief operational level. You can do a bachelor's degree, but a master's is preferred. And there's something called Masters in Public Administration, but there's also a Masters in Public Health with a healthcare administration focus. Know that is definitely a track. And what they do is they have a role of medical care in public health and overseeing that. They help with the medical care cost. And then they're really looking at health insurance and making it more accessible, the quality of medical care, and really looking at it to really look at how to really make healthcare affordable, but also address it from an administrative perspective. And I should also say, this one was focusing in on administration. There's also an aspect of a public health aspect where someone's looking at healthcare policy, which really does influence healthcare. The other job that I was going to put in, that I'm putting in here is medical and health services managers. This is under not so much a chief operating officer level, but overseeing programs. A bachelor's degree and master's degree are some areas to look at, and you can look at the different areas where you can see what the work environment is and the state, again, off the Occupational Outlook handbook. One that I don't really go into with my introduction to public health classes, but definitely is out there, is something called emergency preparedness. And so every county has someone that's pretty much in charge. And I did a screenshot of Kern County Fire Department where they have their emergency preparedness and they have someone overseeing that. Know that the public health department has an emergency preparedness area. And this is something that public health is constantly working on, is doing emergency preparedness plans from anywhere from an earthquake to a natural disaster to a terrorist disaster, a bioterrorist disaster to infectious disease disaster like a pandemic to opiate crisis. They have something called incidents command centers. And so that's an area to explore if you're interested in that area. And this kind of gives you an idea of some occupational employment for health educators. That really should have been up with health educators. But you get the idea. I have to tell you that I did emergency preparedness and I was a health educator in that area. So know that sometimes we will actually cross the different sectors as we're working to do outreach and programs. So where do you get started? How do you get started? What you need to do is you need to start by looking at all the career opportunities and set up alerts. You need to look at Deschutes, like if you're in Oregon, look at your county to set up alerts, look at nonprofit organizations, make sure that you actually sign up for any alerts or any opportunities, and then also job shadow and talk to people that if you want to be this person in a few years and want to do this academic pathway, look into job shadowing or possibly an internship. This is Kern County. They actually have alert systems where you can sign up for alerts, and highly recommend that. And again, you can look at different careers at public health departments. Search public health, search in those areas, some of those job areas. And finally, really look into contacting your community college or college. Look and search for public health and look for classes that have that as the title, and look to get into job shadowing or a practicum. Set up a time to talk with a professor about your dream job or career path. Look at a job shadowing, and a lot of community colleges and colleges can do things where they actually give credit as you do your internship. Research and explore. You can also check out a YouTube channel, Sarah Barron Public Health Sciences YouTube channel, where I post some videos with interviews and also past lectures, so you can get an idea of some of the topics that public health classes cover. And I have a publichealthbarron.info website where you can look at resources and local databases, careers, classes, and a blog. I plan to update this more in the future, putting more interviews on here and more information. I look forward to any questions you might have, and I wish you luck as you explore public health careers. It's a great field, great opportunity to make a difference, and a very rewarding field.